Hello, everyone. Welcome, and thank you for joining us on DisrupTV. My name is Vala Afshar. I'm the Chief Digital Evangelist at Salesforce and your co-host for the next hour. We welcome you to follow us on Twitter at DisrupTV Show. Send Ray, myself, David, and our distinguished guests your questions live, and we'll do our best to answer them. It's my privilege to introduce my co-host. He's the CEO, founder of Constellation Research, best-selling author of Disrupting Digital Business, regular contributor to Harvard Business Review, ZDNet, Fox, CNBC, Bloomberg, and many media outlets that I see him almost on a daily basis now. And in my humble opinion, one of the top futurists to follow on Twitter at RWANG0. Welcome, Ray Wang, to DisrupTV.
Hey, thanks a lot. I'm here with my co-host, Vala Afshar, as you all know, the Chief Digital Evangelist at Salesforce, but more importantly, one of the top Twitter followers for CMOs and CIOs, and of course, a leading source for digital transformation and evangelism, as seen in the latest broadcasts in our Bay Area TV networks. So television personality as well, but more importantly, we're here in our special healthcare edition, episode 142, and who do we have as our awesome guest, Vala?
Before I introduce our first guest, I just want to let you know that David Chou, who is now Vice President, Principal Analyst at Constellation, will join Ray and I as we engage with our guests. So our first guest, we're lucky to have Anna Turman, who's Division CIO for Catholic Health Initiative, which as a combined organization headquartered in Omaha operates 15 acute care hospitals, 2 standalone behavioral health facilities, a freestanding emergency department, 136 employed physician practice locations, and more than 11,000 employees in the Nebraska, southwestern Iowa region. So massive area. And is responsible for advising and guiding senior business leaders in the art of thriving in our technology environment to achieve desired business outcomes. So her responsibilities also includes establishing and maintaining a strategic business relationship between IT and its customers, key critical success factor for CIOs. She has a unique, diverse background of over 20 years, so Anna started when she was 5, experience as a leader, as with past roles as Chief Information Officer, Chief Operating Officer, and Chief Executive Officer of Rural Independent Hospital. And one of her strong beliefs is that if you're comfortable, you're not growing. And this show is all about not being comfortable. So please follow Anna on Twitter at IamTurman, IamTurman. Welcome, Anna, to DisrupTV.
Thank you. It's an honor to coexist with you guys today in this amazing avenue. You make me sound more amazing than I think I really am. So I want to just throw it out there. I may have you fooled that I'm a masterpiece. In reality, I'm a work in progress simultaneously. So thank you.
Well, hey, thanks for being on the show. Let's really start by talking about how you got into healthcare and then what drove you, through the different roles that you are. And then we'll go through some other questions around this, talking about some of the big changes and transformation that we're also seeing in the healthcare environment.
Well, as you had said so nicely, if you're not changing or uncomfortable, you're not growing. So I never started out in healthcare. I married a gentleman who moved me somewhere where communications, graphic designer, publication manager was not necessary. So I had to reinvent myself. Very uncomfortable. So, moved into Nebraska, reinvented myself, found myself in a hospital answering phones and then growing from there in technology, just educating myself in just about everything. So that's how I got to healthcare. Kind of a weird direction.
That's amazing. So, I mean, you must, in the process of reinvention, from a single contributor all the way to a chief executive and now CIO of a incredibly large ecosystem and getting larger as we speak. Can you tell us a little bit about the art of reinvention? What type of skills are required? I can tell right away humility is one, because you started the conversation by level setting all of us that you're a work in progress, even though most of us who know you know that you're extraordinary. But what are some of the skills you need to be able to be comfortable with the uncomfortable?
It's a very good question. I think it comes down to figuring out how to ground yourself for one. The reality is, I prefer challenges. I love a challenge. I love a good challenge. That's how I found myself in healthcare. I was like, oh, this is one industry I can stay in and constantly be challenged. I won't get bored. If I was to do something day in, day out, I would tap out. And so, you know, find something that you're passionate about, and that really helps, because when you're passionate, you can make anything uncomfortable turn comfortable. And reality is, you know, as little as I say I am, I'm just that little guy. Size does not determine impact. You know, the small stone can make a ripple. Yeah, there are better stones that if you toss them out, they're, you know, going to make better ripples. Like if you're skipping stones, and they'll make better ripples than other stones. But it doesn't matter the size of the lake. That stone will be a good stone in the small lake as well as the big lake. And it goes the same for a fisherman. That fisherman is a great fisherman in the small lake. He can move to that bigger lake. So if you're going to be uncomfortable moving to the bigger lake because it seems foreign to you, just know that if you're a fisherman in that small lake, you can be a great fisherman in that large lake. What do you need to do to, you know, pack for that, this incredible journey of, you know, uncomfortableness? You need all sorts of different tools. And the biggest tool you need is you. I mean, that's the one tool you need to pack. You have to look at, it comes down to things that in a small lake, you know what you're good at, what you're passionate about. Small organizations, they'll prepare you for wearing multiple hats. They'll prepare you for, one of my favorite things was, okay, we're not man-on-man defense, we're zone defense. So how do you do that? You look at diverse synergistic teams where 3 people are going to equal 5, 6, 7 people. That's zone defense, right? And if there was a zone offense, I would go for that, because sometimes defense is not the right position you want anyway. But that's how you build that high performance. And that's what's going to help you understand. And those small organizations will help you understand and build that comfortness in anything that's uncomfortable in the changing world that we're in. You know, you must be able to be that transformation, that change agent, you know, because if you aren't, it's always going to be comfortable, right? You're going to stay comfortable because you're not an agent of that change. And then you're just going to be upset and constantly battle with the uncomfort, right? And it comes back to that ripple of body of water. So when you're not making that change, you're not stirring it up, or at least asking questions and making yourself uncomfortable, because sometimes asking questions creates that uncomfortable because you don't have the answer to something, right? But the reality is, if you're not asking those questions, you're not tossing that rock and creating some ripples, nothing's happening. The lake's starting to settle. No skipping rocks, no boats are running on it, no fishermen, no swimming, no diving, no adventuring. You know, go outside, dive into that water. There might be some rocks below, but you get through that, right? So the reality is, do you guys know what happens to a lake when it settles and nothing's rippling and there's no change? Yeah. Mosquitoes start coming in. What was that?
So Anna, you know, we're talking about change. We're talking about how individuals must change. Organizations must change as well, right? Healthcare is changing itself. We're looking at the organization that you're at right now, where it's the massive merger between and becoming the largest entity in healthcare in the U.S. Now, what type of change is the organization going through now, and what type of business model do you foresee them having to shift in order to be successful? I mean, what are you guys focusing on right now? Is it just merging together, or are there more things that you could discuss that's not behind closed doors?
Well, since I've only been with the organization for 2 months, I would say that is the unknown, the uncomfortable piece, still learning it. That's a piece. You're always learning. And that's why you don't stop being uncomfortable, because if you stop being uncomfortable, you stop growing, you stop learning, right? Well, I'm in the uncomfortable. I can't answer that question because I may not know exactly what's going on, right? I don't have the perfect view. But you know, the one thing, the model that from the IT perspective, the model that's really important that you need to be more flexible with or agile with is stop focusing on the technology as much as start focusing on the people, the who and the why, right? So if you're constantly asking the question of who and why, and you make sure you have those aligned, then the technology will be a lot easier to implement, and then it will go smoother. The processes will be vetted, so to speak, because you're staying and you're asking those questions. Who are going to be using this? Why are they using this, right? An MRI is an MRI is an MRI. A CT is a CT. Yes, you can get additional slices. You can, more slices, better CT. But if you don't stay focused on the patient and the who and the why you're doing it, staying focused on your mission and vision and keeping people engaged in that, then, it doesn't differentiate you. And that's the model you need to look at. What differentiates you? It's not that you're using that CT that's got more slices than the next hospital. It's how you're delivering that service. It's who those people are who are delivering it with excellence, right?
Right.
So how do you get people excited about moving in a patient-centric direction and making those investments? Because it's kind of a hard thing to do in a lot of organizations. And does it change based on the size of the hospital that you're at or the health system?
Well, look at me. I mean, who doesn't want to follow this crazy, exciting, right? It's like a petri dish. You've got to constantly manage up. You've got to constantly manage expectations. If you don't manage expectations, you don't manage up, you're going to find yourself in a hole. And it's interesting because you can look at holes in several different ways. Like, okay, so yes, as a CIO, you're like a 100-foot deep hole, right? And then once you become like a CEO, you become 100-foot breadth of a hole, right? It's 100 feet wide, not deep. And the reality is, stop looking at it like a hole, right? Create some really, some angles in that hole so it comes down so you can get out of your hole. You need to be able to get out of those holes, right? So you just encourage folks to, you encourage them to come along with you and say, this is a hole, stop looking at it as a hole. Let's create this angle to be able to get in and out of those holes, be agile about that, and continue to lift each other up, manage up, lift each other up. There's more to be said about lifting people up. That is something I will always speak to. I believe in people more than they believe in themselves. That might be a fault for me. I actually think it's one of my weaknesses. But if I consider that it's a strength and kind of flip my view, which is what we're constantly doing in healthcare, look at perspectives from every angle. You look at it and you say, hey, that's not a bad thing. It may bite me. It might come back and bite me, but we've got to believe in our folks that they can get through it. And then we got to help them meet us 50% of the way so they're believing in themselves as much as we believe in them.
That's terrific advice. That's terrific advice. I can't tell you how much David and I love speaking to a CIO who uses man-to-man, zone, box and one terminology to describe how to manage business. That's just pure awesomeness. So you were interviewed recently, and they asked you about improving healthcare, and you said that a significant first step is to do the right thing for the patients first. And then you followed up by saying another crucial step in terms of being focused on the patient is creating partnerships inside and outside of your community. So, seeking random collisions and learning and adopting a beginner's mindset by looking at anywhere there's innovation and leadership best practices. Can you talk a little bit about the importance of building a community in order to stay teachable and in order to be a trailblazer such as yourself?
Well, like I was speaking, I can't know everything, right? How do you pack for that kind of journey? I can't know what's going on externally and internally and all these things. So it comes back to those diverse teams, creating synergies. You must create those connections, those synergies, and build outside of your area to get a better scope of it. We're not in a fishbowl. It comes back to, again, staying focused on that patient, like you had said. I look at it this way. You guys know True North is actually according to Earth's axis as opposed to magnetic north, right? So it's all about orienting that point, and it can be unique internal compass, and it'll be very unique. And that's kind of how you build that culture. You stick to those unique internal compasses, that true north, and it represents who you are at the deepest level, right? And so I need other people who are like that who make me better, and I help lift them up and make them better. Because leadership is a reflection of who you are, who I am, and others will emulate that. Again, it's that petri dish, you know, we just got to go out there and create those relationships and look at coordinated care from all aspects. We can't look at a patient from inside walls. They have to be looked at from outside walls. Half the stuff they do isn't even, we have no idea what that is. And how do we get a better picture of that? We start creating a bigger team. And that team can include, you know, their grocery store.
Right.
Wow. So hey, Anna, let's think top 3 transformation areas. Where would you jump into?
I don't know, David, where would you jump?
Well, think about your role as a CEO. Has that changed much? Are you looking at consumerism? Are you looking at massive personalization efforts and where you're moving towards? Obviously, security is going to be top of mind for you. Those are probably some of the key areas, but I'm sure in your role and the hat that you're wearing, going from the CEO to CIO, there's some resemblance. So we would love to hear about some of those trends that you're focusing on.
So even as a CEO, security is always that front of mind. And it's less about security and more about risk. And we need to look at that from COO, CEO, CI. It doesn't matter what suite you're in or what leader you are. Look at the risk. And so I guess I would focus more on being able to look at transformation and risk, because the reality is it's expensive now for technology, and we're just creating, it keeps creating on top of itself and growing. Those risks are becoming more costly, especially in security. But it can be from patient safety. Those risks are what needs to be managed. So that's something we need to look at, how we make sure that cost is contained. Yeah. Maybe look at risk from a different angle. So.
Sure. You talked about, connectivity and communication always being a priority in addition to security. So, technologies that help with teletrauma, telepsychiatry, teleradiology, but now also shifting towards telehealth and telemonitoring. So given the wearables and the ability for, especially when you're in rural areas and you have, 15 hospitals and 11,000 employees, maintaining security connectivity and being able to have proactive monitoring for preventative care so that you can reduce the number of visits because you're helping guide a healthy path. That must be an exciting, area of innovation for you.
Yes, actually, it's and we live in Nebraska. There's a lot of rural, so access to care, consumer and telehealth. All those things are going to help us drive that ability to help allow that person to have that access to care, whether it's preventative or even maintaining, chronic care conditions, right? Or home health and hospice. The funding for those programs are getting cut, and they are a crucial piece. And if you look at that, there are some different scopes we can look at that says, okay, well, we're cutting here. How are we able to still make the impact we need to make? And we're leaning towards telehealth. We're leaning towards, that consumer wearables. What we noticed here in rural Nebraska is that we don't have the accessibility based on the infrastructure. So even from broadband, or even, I'll tell you, there's some cell service holes out here. So how do we jump to that piece? We have to still look at our infrastructure. And I think this way for many states. A lot of them are looking at it themselves. I actually am on the Nebraska governor's task force for broadband, because we need to look at that infrastructure so that we can grow in that avenue. So
final question, Anna. We talked about security. We talked about how every organization has a lot of legacy technology. Therefore, it's hard to keep up with security without making a massive investments. Are you faced with that same issue and challenge that other CIOs are facing?
Yeah, it's the larger you get, the harder it is to even track items. So, I'm sorry.
No, I said it's true. I agree.
So true.
Yes.
Yeah, I agree.
And so a big piece of that is transparency, communication and transparency. We can't make decisions if we can't see what we're making our decisions on. I can't make decisions based on risk without being able to see all those holes we have, or all the equipment we have and where they're at. Do we have servers that are still in 2003? Maybe. Do we have a good way to view that? Where's that transparency? How do you put that dashboard up so that people can see it? And so there's a lot to work for everyone. I don't think anybody's a perfect communicator. And if they say they are, they might be lying. um, the reality is, how can we best make that transparency so we can better communicate and make better decisions? And it really is, we don't know half the time what's sitting out there. And that happens in small facilities. You know, oh, we turned that server down. We're not using it anymore, but we're still paying for that maintenance contract. You know, those are the questions you have to constantly, and unfortunately, sometimes you have to dig into the weeds. I know as executives, we're not big on wanting to dig in the weeds because we have a lot going on and making sure everybody's staying focused. But sometimes you got to dig in those weeds and find out so that you can build that transparency.
Wow. We are live here with Anna Turman, Division CIO at Catholic Health Initiatives, part of the new Common Spirit organization. And more importantly, you can follow her on Twitter at I am Turman. So, hey, thanks a lot for being on the show and happy Friday.
Thank you.
Thank you, Anna. David, send Anna a pair of Constellation socks. She was awesome.
Got it. We'll get her the whole get-go, the jackets, the socks, water bottle too.
Definitely the socks. She's a brilliant CIO and former CEO. And speaking of brilliant CIOs, our next guest is Tom Stafford. He's the Vice President and Chief Information Officer at Halifax Health. Tom joined the organization more than 11 years ago after a decade working as an engineer and product developer in the medical device industry. He's responsible for overall leadership in every IT initiative at Halifax Health. He blends his engineering experience, so he was an aerospace engineer and a mechanical engineer and a US Navy veteran, so highly accomplished, and for optimizing processes and systems with his management skills and mentoring and coaching his staff. He's created a culture that has put the hospital on Computer World Magazine's best places to work in IT for 4 years in a row. And we're going to learn about an unheard of attrition rate for 5 years at Halifax, largely due to cultivating the culture led by Tom. Tom won 2007 Computer World Premier 100 Award for his leadership and innovation approach, and was named one of the top 100 CIOs in 2018-19 by Becker Healthcare. Tom, welcome to DisrupTV. You've done a lot.
Well, thank you guys. And I got to say too, I've watched some of your episodes, and what you're doing for the tech community is pretty outstanding. And I like that you're doing a healthcare segment too, because we're a little bit behind in technology and healthcare, and we're trying to catch up, and we can learn even from other industries that you've had on. So toast the bun to both of you, and David too. You've done an amazing job, so I appreciate it. So yeah, I'm not your normal CIO, just like Anna said, right? She came from a totally different industry, as did I. And I was in the Navy, and I wanted to design jet engines because that's what powers naval warships. So as soon as I got out, I went to Embry-Riddle Aeronautical University, and I got a degree in aerospace engineering. Ironically, it's across the street from the hospital. And if you would have asked me that when I was graduating, I'd been like, I'm not going to work for a hospital. I'm going to design planes. And I didn't do any of that. Actually, I went to work for a medical device design company and did that for 10 years. And unfortunately, I actually designed some of the medical devices that we're now struggling with in IT security and healthcare. So it's talk about full circle. And then I did get a master's in mechanical engineering. And I won't go into the story how I totally switched careers, but one of the things that I was excited about was, instead of designing these brand new medical devices that had never been designed before, I'm like, oh, I get to go into healthcare IT. And all I got to do is install software systems. So that should be a piece of cake. That'll be a little bit easier than what I'm doing today. And I was at Halifax, I think, for about 3 hours. And then I realized that software requires adoption. And adoption is very difficult in healthcare. And adoption is all based on culture and behavior, obviously. And it's a big deal. And so very quickly, I learned that in order to be successful as a CIO, or just in IT in general, and to promote all this change, because that's what we do, is that I had to be able to get it done. And so to get it done required persistence. You can never give up. And then the other thing I did too is you had to take the change and break it down into incremental steps so the end user could actually consume it. If you go at a nurse or a physician with a large amount of change, all they're going to do is push back and say, I don't want to do it. And the first time you push back, you lose them. Yeah. So you actually have to take the time and use some project management skills to say, okay, I'm doing change. I need to make sure when I do it that it's in small enough steps that the end user can consume it without going, stop. And so we follow that at Halifax, and we even do that through innovation too. And innovation is a little bit more difficult. But honestly, like I could change a manufacturing line overnight when I worked for engineering and manufacturing arena. And we had to do it because the next morning, if we didn't do it, we weren't going to make money and we could fail. Anything we do in healthcare takes time. It could be the simplest thing, but no matter what, it takes time to do. And the other difference too is you're talking about volume. Anna, you guys just gave Anna's statistics, which are much larger than mine. But if you want to get 450 physicians to start using CPOE, that can be a very big deal. And so you have to manage that change properly. And sometimes you need to give them a little something that makes your life easier, like nuance or just speech rec and things like that before you go for the big change. And so part of everything we do is managing the change. And change management's huge in healthcare. So
now, Tom, one of the big things that you talk about a lot is leadership, interoperability, and innovation. So talk a little bit about the interoperability piece that's important, because you've covered the part that's so important, which is really the human aspect of getting IT done, especially in healthcare. Where does interoperability fit in that?
So it's interesting because the government obviously wants us to focus on interoperability. And they want to be able to connect health system to health system, which makes perfect sense, and I get it. But I'm the type of guy that wants to make sure his house is clean before I worry about the neighborhood. Essentially, healthcare IT came up in silos. I mean, it really started in the data center, and it wasn't the IT data center, it was actually the radiology data center. So the first foray into tech in hospitals actually when we took images that used to be on film and made them digital, right? So now you have these digital images that had to be stored, manipulated, and viewed. So that's really where IT started in healthcare. And then we had pharmacy, which had all these drugs, so that got into tables. And then you also had your lab, which had all these values. So it all kind of started that way. But then we had, you know, the Epics and the Meditechs and the Cerners of this world come out and say, hey, I'm going to take an ERP system and make it clinical. And they started down this path, but they couldn't do everything at once. So what all hospitals did is they bought best of breed systems to help them get to a more ecosystem of stuff they can manage when it came to the electronic world and interfacing with our, you know, patients and our clinicians that take care of them. And so we have a lot of systems that don't talk and have never talked. And thank God for APIs. That is the game changer in healthcare. And I'm glad the Argonaut thing happened. There were JSON, and then I went to the Argonauts, and then we started FHIR. And what happened is now even our healthcare information systems are giving us APIs. And what that does is allows me, and I have engineering staff that can actually do this work. I can't. I just have these ideas, and they go off and make them happen. But now we can start connecting systems in the hospital. And so a lot of the innovation I've been focused on is more incremental innovation. And, you know, and innovation is kind of cool, right? I mean, it's almost like the roar of a Ferrari going down the road. You feel that, you get super excited. And so we've been focusing a lot on that. And there's a big value to it. And even one of the things that I talk about as a CIO, my goal is to keep clinicians away from computers. I'll let that sink in, right? Ray just went, whoa, because it's true. And at the end of the day, the best place for that clinician is next to the patient. It's not sitting in front of a computer. And if you're that patient, you're going to want the nurse or the physician interacting with you, not sitting at a computer typing or not paying attention to you. So we do a lot of things here. We're a heavy user of Vocera, which is a clinical communication system. I don't know if you've seen the badges before. It's like a walkie-talkie, but it's pretty cool. And so we do a lot around predictive or prescriptive alerting straight to the badge. And so this might be my engineering background, but today there's so much technology available. Like it's everywhere. We got all the tech we need, and I'd say the APIs really got us there. Now AI and machine learning is kind of cool, and we'll be using that, and that's where we're going to get to like transformal innovation is by using those products. But right now what I do is I use APIs and I connect systems together, and we take them to some like next generation decision support system, and that provides some actionable information for our caregivers. Then what we do is we send that directly to the caregivers as quickly as we can over their Vocera badge. And so it actually sets it up so they get alerted right away. And they didn't have to go back to the computer to see that alert. Even at HIMSS, like I think 2 years ago, was all about analytics, and they started saying predictive analytics and stuff like that. Well, I don't think analytics are valuable, but when it comes to clinicians, it has to be alerting. So you have to be able to take that analytic platform and whatever information it's providing, and it's actionable information, and you got to be able to get that directly to the caregiver. And so, you know, this year we kind of bet everything on black, and our goal is to focus on innovation in general. Last year we did all these we really replaced a lot of our EMRs last year, and so that was the year of really implementation. And as I met with my staff probably 4 months ago, I said, this is a year of innovation. And so we're all focused on that.
Wow.
So Tom,
that's my definition of interoperability. So
you've done a great job of innovation, Tom. You've been in the seat where most CIOs want to be, and that is you're able to create innovation and also create a separate entity where now you're a service provider of products to other organizations. Tell the world what you're doing there, because that's something every organization, every CIO wants to do, and they always get stuck where the organization may not allow them to create that entity. But you have been extremely successful. We'd love to hear about that.
Sure. So I'm actually, I provide IT shared services to another hospital. So I'm actually a vendor to a hospital, which is odd. I'm also a customer, right, which is on this side. And it's more infrastructure security-based services, and we're looking to do more of it. And that's kind of, and that might be a bit more transformational innovation, right? I mean, because of the fact that there's not a lot of that going on in healthcare today. But I was able to accomplish that with my leadership team really because of the team I have in-house. When you talk about innovation at all, there's a couple of things you have to innovate. And I'd say first and foremost is stability. And what I mean by stability is you have to have stability in the workforce, you have to have stability in your infrastructure, and you have to have stability in your systems. If you have all that, you're not band-aiding things together. Think about if you have a 30% attrition rate and you're losing people could be every week, depending how big you are. All you're doing is trying to band-aid and fill those holes. So you can't actually look to the future and do neat things. So I'm very fortunate in like the last 5 years, my leadership and team and I have been able to do a lot of great stuff when it comes to engaging, empowering, even retaining our staff to allow us to move forward. And essentially, as Vala said, you know, we were named one of the best places to work in IT from Computer World for mid-sized organizations. I have to say that. Last 4 years in a row, and hopefully we're going to get it again this year. And I'd say, so that's validation of something we accomplished. And one of the best metrics I have for my team today is that my attrition rate has literally been less than 6% for the last 5 years in a row. So we got a super stable team.
Amazing.
And now we talk about stability, or when we talk about attrition, you talk about it's essentially when you lose a person, it's their salary and cost to replace them and get someone else trained up. And I think there's a lot of validity to that. But when you can retain your staff the way we have been able to do, the greatest benefit I've seen from it is that everyone knows everyone's strengths and weaknesses. So what that means is that I could have a business analyst talking to one of my platform engineers in the hallway, and they're solving a problem I didn't know existed. And the reason why they can do that is because they understand each other, and they know that Corey's really good at solving this, or Cody's really good at solving this. And we allow empowerment, so we don't have the requirements, well, you must go see the manager before you go talk to a team member. I just want everybody to talk and work together, and we've been able to accomplish that. And that's allowed us to do what you just asked about, David, which is actually we have so much stability at our home hospital that we were able to actually take that and project that to another hospital. And the only reason we were able to do it is because we were able to change the culture, hands down. If we wouldn't have been able to change the culture and create this very stable team that's focused on making things better and moving forward, we couldn't have done it. And I like when I brought up team, it made me think of something too. And so a lot of folks have big, huge strategy documents that they write and spend weeks writing, and they do about 25% of it maybe, right? And so they come crashing and burning, and I'll just refer to those folks as crashers. But what we do at Halifax is we don't focus so much on a bunch of strategy documents. I mean, I have my risk management plan that Anna and you guys were talking about cybersecurity before. And I also have like an infrastructure refresh plan that I use to make sure that my infrastructure is always stable. But essentially we have 4 core objectives in IT. And the first one I'm going to talk about, you actually tweeted yesterday about Vala, which is customer service. So our first core objective is customer service. And so besides being courteous, kind, friendly, respectful on the phone, owning a problem until completion and providing feedback, in healthcare IT, another part of customer service for us is that we don't talk tech. If I talk tech to a nurse, or one of my senior, my support technicians starts talking gigabytes or virtualization or anything like that, the nurse is going to clam up, and she's going to get embarrassed. He's going to get embarrassed, and they're actually never going to tell us what the problem was. So we always talk to the technical ability of our customers that are calling us. And then the second tenet too is we never say no. There is probably 1,000 ways to solve every IT ask or challenge. This might be from my engineering background, but we have the tech to do it. So even if we can't do exactly what the customer wants, we give them 5 options that are pretty close. And they get to choose one, more or less. And if I were to say no, they're going to try to do it anyhow. And as soon as they try to do it, it's going to affect my serviceability. It could affect my reliability, and it actually could make me more vulnerable for a cyber attack. So I make sure that we always say yes or no with a lot of options. Our second core objective is to maintain operational stability, which is a super fancy word for keeping the lights on, or 5 nines. And so we've done a lot of achievement around that. We're actually the first Meditech hospital to be able to do server patching without bringing the system down. So we actually worked very closely with Meditech to solve that problem and create the architecture we needed to do so. And so this year I'm actually going to be 5 nines on our core healthcare information system. And as soon as we reach it, we're going to have a 5 nines party. I'm actually going to paint 9s down the hallway, just as a reminder how important 5 nines is. So I'm pretty excited about that. And what we did is we took away the downtime from our clinicians from Sunday morning from 1 a.m. to 5 a.m. And instead, IT has to do a little bit more complex work, but it's allowing the physicians to keep working and stay in their system. And one of my beliefs behind that is care at a hospital is 5 nines. You come to Halifax at 3 in the morning on a trauma or life flight, or you're here at 10 a.m. in the morning or 4 in the afternoon, there's going to be a nurse and a physician there to care for you. So I have to make sure all our systems are up and running for them. Our third objective is to enhance operational and strategic initiatives. And that's a very fancy word for making things better or innovation. So we've talked a little bit about interoperability, as that's really my focus there. And then our final objective is to safeguard our patients' information, right? I mean, when you go to the hospital, you're actually allowing that hospital to safeguard your information and allowing that hospital to be stewards of your information. So that is very important to us, and we follow that every day. So if I have a team member doing one of those 4 objectives, good. If I'm doing 2 or 3, great. If you're doing all 4, you're a rock star. And that's kind of how we do the day-to-day stuff at Halifax.
That's amazing. That's amazing. So there was a ton of nuggets in what you just said in the last few minutes. I just want our audience to understand. So speaking the language of your customer is key. So don't talk tech, talk outcomes. That's awesome advice. God, I wish more CIOs understood that. There are no IT projects, they're business projects. 2, you talked about radical transparency and accessibility as key to cultivating a culture of innovation. Make yourself available, and chain of command is great. Obviously, I'm speaking to a U.S. Navy veteran, but be comfortable talking and collaborating because that's how you get things done. Cleaning your backyard before you're asking your neighbors to do so. Huge advice. Like when you talk about stability and balance and 5 nines and operational excellence, unless people perceive you as being an excellent organization, they're not going to give you the privilege of experimenting and innovating and growing. So these were amazing nuggets. But the one that really resonated with me, we talk a lot about maturing in terms of analytics, from descriptive to diagnostic to predictive to prescriptive. And you said predictive is good, but the name of the game is delivering insights and engagement opportunities at the edge of your business. Alerting to me is telling the caregiver, do something because here's the insight you need. And so that's critical. That's awesome CIO advice. It's about understanding engagement opportunities so you can build even more trust and respect for the IT organization, the business as a whole. So I'm getting a sense of your leadership style, but in addition to these nuggets of wisdom, what's one advice you can give to a new CIO who's trying to really build and follow your track? What's that one thing she needs to do to be able to achieve, all these awards and accolades that's coming your way?
You can't achieve it without your team members.
Wow.
It's not an army of one. I couldn't do anything I do today without the amazing staff that supports me in the hospital, hands down.
Yeah. Ray, you're on mute, Ray.
Wow, this is great. So, hey, Tom, I mean, this is we're definitely seeing a lot of transformation, a lot of innovation in hospitals. We're here with Tom Stafford, VP and CIO at Halifax Health. And more importantly, you can follow him at tstafford300 for some interesting tweets. And more importantly, hopefully we'll see you at our CXO Healthcare Summit coming up in May. So All right.
Thank you all. Appreciate it.
Thank you so much.
Take care.
Happy Friday.
Dave, see, now I know why you're so smart. You hang out with these folks that are just crushing it.
That's the key, right? Be around people smarter than myself, like you guys. Just like I come on and join you guys on this show, and I learn so much being the third wheel.
No. I mean, who's
No,
concept that we're the mashup of the 5 people we're closest to? Certainly Ray, I'm with every week, so that's a privilege. But before we get into discussing what Anna and Tom said, I want to just properly introduce David Chou, who's Vice President, Principal Analyst at Constellation Research, covering the intersection of healthcare system, stringent processes and regulations, and the transformational power of technology, which is funny. We really just touched a little bit. We talked about a little bit about AI, machine learning, but at the end of the day, we all know that it's culture, people, process, and lastly, technology when it comes to success. He's got 20 years of experience as a senior IT executive. He's been named by numerous publications before he joined Constellation as the top social CIO, one of the most innovative CIOs in healthcare. In fact, kudos to Ray and Constellation. You recruited, in my humble opinion, the best of the best to join Constellation. So welcome, David. The first time on DisrupTV as not a CIO, but someone who's now tasked with helping CIOs. So welcome to Disrupt.
Thank you. And now I get to give the real story, right? I think that's the key. Now we get to talk about the real stuff that's not going to be behind closed doors.
Absolutely. By the way, before we start, follow David. He was named the most social CIO in healthcare. So
yes.
Often I say follow people on Twitter, and I mean it every time. But if you're not following David on Twitter, then you're absolutely missing out on the best and brightest piece of content on a daily basis at DChou1107, DCHOU1107. Okay, now let's do this. Ray, go ahead.
All right. Well, let's lay it out here, right? You've been the analyst for a little bit now. You've taken all your experiences as a CIO and looking at digital initiatives. What are the big trends, right? What are the big healthcare trends that people are talking about over the next 3 to 6 months and even out to the rest of the end of 2019?
Yeah, there's a huge trend right now where, unfortunately, there's a big focus on cost cutting, right? There's not one healthcare institution that you're not talking that's not focusing on cost cutting, or a better name for it, operational efficiency, or they're trying to work on lean organizations and they're trying to lean out. That's the nice words for cost cutting. So everyone's doing that. Concurrently, they want to make these investments into their back office systems, particularly ERP. Because in healthcare, it's been neglected for the last 8 to 10 years. Everyone's been focused on the EMR. No one has focused on the ERP. So now you're focused on optimization, and everyone says, oh, how do we improve this process a lot more efficient? At the same time, we have outdated legacy systems. So trend number one, that's going to happen in the next 2 to 3 years. Every organization I'm talking to right now is focusing on some sort of RFP in the market on their ERP transformation, back office transformation. Number two, you hear a lot about consumerization, just like every other vertical out there, whether it's retail, finance. They want to create this personalized experience. While healthcare is ripe for that, they need to create this interactive one-to-one relationship with the patient now that people can seek care anywhere in the world. If you think about yourself as a patient, you're going to go for convenience. That means you're going to use a virtual care model if you just want to get medication for something as simple as the flu or cold. You don't need to actually go to a physician's office. You could pop up a virtual care visit very easily, and that doctor can be halfway across the U.S. or across the world. Most likely to be in the U.S.
I know. Just with a phone, you can get started. I mean, people are doing visits off iPhones and FaceTime, and it's kind of crazy. So.
Yeah. So that's a trend right there. You got to focus on how do you create this personalized experience, because you have to create that stickiness with the patient. So that next time you're sick, you think about, who am I going to use today? Is it going to be the Mayo Clinic or Cleveland Clinic, or do I use my regional partner? Third is security is everywhere, right? You hear about every industry focusing on privacy and security. Healthcare is one that is really suffering. Just because for the last 10 plus years, the infrastructure has been outdated, has not been upgraded, and has not been a big focus. So if you don't have a good core infrastructure, that translates to outdated security. So now the biggest challenge for CIO is, security is a top 3 issue for the CEO and the board. Now go fix it as a CIO. What do you do? How do you make that up? Do you get a massive amount of money to fix it? Great, I got the money, but I don't have the talent now. Or I have the talent, I have the money, but these are competing priorities. it's a really tough task for CIOs to juggle. And I see that all the time right now, where because it's got to be the top 3 issue for the board, it's sort of as if it's just tossed over across the fence to the CIO to fix it. And so that's a trend right now. How do you keep that security? How do you keep the brand reputation? And most importantly, how do you keep the information for a patient safe? Because the safe part is crucial.
So David, the taxi industry 10 years ago never thought ride sharing was going to be such a disruptive force. Lyft IPO today at 24 billion. At some point they hit $88 a share. Uber is going to be about 125 billion is the estimates when they go IPO later this year. So that was 10 years ago. Netflix 5 years ago didn't think Amazon was going to be the biggest threat to them in terms of streaming video. And clearly with Amazon, Apple, and other players, it's more than just cutting cords. You're going to see an entire revolution where, media is now in your pocket, not on a, hanging on a wall or sitting on a bureau somewhere. So let's fast forward 10 years from now. Will Amazon be one of the biggest players in healthcare with their Whole Foods play, with their ability to know how much time you're spending in front of the screen and all that advanced analytics that they have? When we talk about trends in the near term, if we go a little bit further, are we going to look at a whole new set of players that are going to completely change the consumer expectations of what healthcare delivery should look like?
So yes, I think these major tech companies really want to transform the industry. But here's one thing I would challenge them to think about is a lot of folks have tried it. Google to Microsoft, they have all tried it. Some have failed. The problem that the reason why they have failed is they have never operated in an entity, whether it's an ambulatory clinic or a hospital, without getting into the nitty gritty and understand the operations. It's really hard to transform healthcare as a whole. You could probably transform pieces of it. Amazon can do a great job transforming it from a logistics standpoint. Who has the best supply chain in the world? They could probably come in with the whole pharmacy distribution, figure out how to transform that industry, but they may not be able to transform the end-to-end patient experience unless they really make that investment into having a healthcare operations, whether it's buying a clinic or taking over a hospital. I think those are the areas that they need to make a really big push in to really transform the industry. Otherwise, it'll be incremental. But I think they'll do a great job. I think they're bringing the right players. Right now, they're looking at from an analytics play. They're thinking about how do you look at it from a supply chain pharmacy side, tying that into retail. But you think about the entire ecosystem of the hospital system, inpatient side, the surgery, they're not there yet because they don't have a hospital operations.
So supply chain monitoring, preventative. So we have to look at the entire life cycle, and they may be somewhere in the front, somewhere in the back, but the middle messy part is going to take some time.
Yeah, and I'll give you a great example. If you look at the ecosystem healthcare globally, I'll use Asia specifically. You have these major healthcare players in Asia that's funded by big tech over there. And they're not just looking at a piece of it. They want to control the entire spectrum of healthcare, meaning from birth until you die. So what they want to do, they want to put together an ecosystem to manage your healthcare for delivering babies. They'll put together the intermediate stages to provide care, and then nursing homes and funeral homes. So they're going to provide a business model for that entire ecosystem. Wow. Massive investments. So when they come in that play, that's when you could really disrupt the model versus incrementally.
Wow, so you're talking cradle to grave coverage of everything, and they're basically building all those business models, and tech companies are coming after this space. Now, in healthcare though, what industries do healthcare providers and CIOs and CXOs learn from? Is it retail? Is it hospitality? Is it manufacturing? Like, where do some of these lessons learned come from that are more interesting?
My opinion, the retail side, right? The way the retail approaches the personalization effort, that's where healthcare has to move towards. There's a big play right now in healthcare towards value-based care, which is moving towards providing care based upon your outputs. Population health management, you get paid and reimbursed based upon the outcome versus the fee-for-service. Traditional model, similar to airplanes. How many seats can you fill in an airplane? Same with hospitals. How many tests, how many patients can you see? New model, how efficient is your process? So now you have to understand these patients so well. You have to understand how they're acting outside the four walls of the hospital. Every organization in the US does extremely well when the patient's inside their hospital. But once they leave, they have no idea. I mean, prime example is if I was going to a hospital, I get treated, they tell me, David, you're on a low sodium calorie diet. Great, I stick to my diet when I'm there. When I go home, I go to Chipotle, I go to Burger King, I order I order anything I want. They have no idea. But that's where they need to really have that personalized effect on me. Say, hey, David, don't order this. Maybe change my ordering decisions. Instead of a double Whopper, a chicken sandwich. That could help me stick to my diet. But because they don't do that currently, they'll never get into this value-based care, population health management play. But that's where retail does really well. They know exactly my shopping habits. They know when I walk to Nordstrom, this is what's going to entice me. A coupon may pop up. So this is where healthcare is learning from. And they're still trying to understand that invading the privacy effect of the patients. So it's not taken off as quickly as we would like it to, but that's where they're learning from tremendously. And that's where the good players are.
That makes a lot of sense.
I know David's a foodie, so I'm pretty much sure he's never stepped into a Burger King outfit. But, I know him and Ray only eat the best. Okay, so I think all three of us agree retail is a great sector. We were both Ray and I were at NRF Shop Talk. When we go to these annual conferences in retail, you do see speed, personalization, and intelligence as the new currency that's in high demand in retail. Having said that, how many healthcare providers have the gumption to hire a CIO from retail to lead their business? Do you see that happening? Because I feel, and can healthcare industry attract a strong retail, innovative CIO when she's going to walk in there and go, oh my goodness, I've got like 20 barriers to jump in order to implement something which I could do in a year or a quarter or a month in at a Nordstrom, as you mentioned. So what are you, as far as advising CIOs in healthcare, how many of them come from retail background?
Very few. I think people are starting to look outside for different ideas. But here's the challenge. Walking into healthcare operation, you must be able to speak the lingo. If you can't speak about the operations, it's very tough. So it's very tough for anyone outside of Vertical to walk in to talk to a physician about length of stay, talk to a physician about case management, understanding how their routine works. So that's where the challenge comes in, but they are starting to think about it and bring them in as chief digital officer. So that's a trend that CIOs have to worry about, is when they bring in a chief digital officer that comes in, does all the cool stuff. And the CIO just keeps the lights on and manages the technology infrastructure. So that trend is actually happening. We
know a couple of people doing that well. So.
Yeah, exactly.
We won't name them, but yes.
But here's the second reality that I could talk about now. When you ask every healthcare organization how much of their contract is really at risk aligned with population health and value-based care, is it more than 80%, 50%, 30%? Majority of them have it below 50%. Therefore, you're not really making that change yet. You're not really going all in, making that investment towards value-based care because your contract is not set up for. So now as a CEO, it's very tough to go to the board and says, I'm making this big push for value-based care, but the next 3 years, I'm going to be in the red. You have to trust me, guys. Trust me. I'm going to be losing money for 3 years, but we're doing the right thing. That's a very tough proposition. And that is what the executives are faced with today, where they want to do the right thing. The reimbursement alignment is not aligned with it. They can't do the right thing because they're going to lose money. So what do you do when you have to go to the board with that proposition? So it's a really tough balance. And I don't know what the right answer is, but that's what the reality is we're facing with in healthcare, which is the reason why they can't go all in with that model similar to retail.
Wow. So is the answer a slow hybrid operation model where over time they can swing to value-based? I don't, it's almost like the innovator's dilemma with Clay Christensen's book. You recognize the right thing to do, but you're so incentivized to the current revenue profit metric system that you see disruption coming and you ignore it to a point where you're no longer relevant. So yeah, well, I guess now this is why you get paid the big bucks, to advise them on how to combat these challenges.
It will be a slow progression, right? If you look at it, it is going to be a slow progression. If you look at just healthcare in general, the reason why people say it's slow is because of these external factors that other industries may not be involved with. So therefore, it is a slow progression. But if I think about the macro trends, right, just healthcare in general, the last 10 years where they went from paper to mostly 90% of the organization are digital now, that's a major shift. Not too many industries can say within 10 years, we've gone to that paper to digital experience. Obviously a lot of influx of the regulatory requirements to get there. But that's actually a proud achievement that industry can allude to. So from that standpoint, I won't say healthcare is always a laggard, but overall, I would say yes, it's going to be an incremental approach. As Ray would say, maybe not even fast followers, more of laggards to at some stages.
They're probably more cautious.
Cautious adults, that's right.
But hey, so we're hosting these healthcare summits. Tell us a little bit about the next two and why these are so important.
So this is, for the last 2 years, every time I attend events, I've had the pleasure of having folks like Tom and Anna where we get together, except there'll be 20 or 30 of us that always gets together at every single event.
These are all
and one day, all CIOs,
Okay.
all CIOs will get together. Just like when you go to conferences, here's the reality. You probably don't go to every session, but you have these carve-out sessions that you go down, at the bar. So we'll get together, sit down at a table, and we actually talk about some real stuff. And one day someone says, hey, David, why don't you just get us together and host an event and we'll all come. So that's how this CXO Summit started. And I had the luxury of partnering with the team at Constellation prior to joining them, to where now we had this great content by Ray and the staff, and we bring these 20 to 25 the top thought leaders in the US to talk about the real stuff. It's a roundtable. It's not the traditional panels where people go on stage and showcase, because at the end of the day, everyone can go and showcase. And during this forum, we actually talk about our problems. How do we solve it? And we love to hear the partner side. When a vendor comes to the event, their input is so valuable where they could share the insights from other industries, and that the CXO they soak it up. And so now you have this really collaborative discussion between vendors, CXOs, and we go on for hours on the topic if we had to. And that's how this forum comes about, to where we bring these 20 to 25 the top leaders, and we actually have a great discussion for a day and a half. And props to the team at Constellation for helping with this.
It is amazing. I attended one with about 20 CIOs, David's events. And so I'm prepping about health cloud. I'm prepping about Salesforce go-to-market in healthcare and all of this. And then I get there and I go on stage and David is, hey, talk to us about why being on social media is important and how do you build a culture of collaboration. So the entire conversation had nothing to do with Salesforce or any of our products, and everything to do about leadership, which was magic, because once I got off stage, I had dozen conversations with CXOs about benefits of collaboration. How do they get started? Some started blogging, some started having a more active presence on social media. And it was kind of cool. It was really cool. So keep having those sessions, because anyone who attends, you're there learning from each other. And you're right, most conferences, it's the unconference part where often the magic happens. And you guys have kind of created a whole unconference model. So it's cool. It's cool.
Yeah, at one of these, maybe not at our event, Ray, but at another industry one, we're going to, behind the scene, we have this chat group. We're going to put together a food truck, CIO food truck, because we love food. And we're going to have the CIOs making the food. So be on the lookout for that one. That's going to be an experience, maybe a new business model for the folks that do not want to be CIOs.
You have to stream that. That's a viral stream. If you show CIOs, I don't know if you saw the movie, I think it was called Chef. It was about essentially a food truck, a chef, a Michelin star chef starting a food truck business and reinventing himself. Do that with CIOs, and that would be awesome, because as you're cooking, you talk about interesting topics. Because I imagine creating a beautiful, delicious meal probably takes the same planning, collaboration, the right tools, the right timing as digital transformation in healthcare, just in a shorter span of time. So I love that idea. I love it.
Well, we're here with David Chou. You can follow him. He's now a VP and Principal Analyst at Constellation Research. He's covering the CIO view in healthcare for us. And more importantly, you can follow him on Twitter at DCHOU1107. So, hey, happy Friday, David. Thanks for being on the show.
Yeah,
thanks for having me.
Thanks. Hey, Ray, I think we found our substitute.
Yeah, we got our anchor. We got a guest anchor. So.
I'll tell you, Dave was born to do this. He was awesome. And in spirit of transparency, we didn't prep with Dave at all for this show, and he just so that was pretty awesome.
Well, we are up episode 143, 11 a.m. Pacific, 2 p.m. Eastern every Friday. Episode 143, who do we have next week?
Yeah, we have Erica Dawn, keynote speaker on collaboration and CEO of Potential. We have Megan Eisenberg, Chief Marketing Officer of Trip Actions. And we have one of our favorites, Esteban Kolsky, Principal and Founder of ThinkJar. So we have a CEO, a CMO, and one of the most dynamic thought leaders when it comes to customer service, customer experience, and enterprise software. So a must watch next Friday on episode 143.
Yeah, we'll get a chance to see Megan's new role. Many of you guys remember her as the CMO over at one of the big MongoDB NoSQL startups. So very interesting, going from B2B to B2C. So very, very interesting. So any last thoughts, Vala? What do you think? What a week.
I'm hosting Boston World Tour next week and Toronto World Tour the week after that. And so I'm trying to not follow Ray's footsteps of being everywhere and anywhere, but it's been an amazing year so far, and I look forward to our paths crossing at some point. So if it's Friday, it's DisrupTV. Closing remarks, Ray.
I don't know. I'm checking out the Lyft IPO. Let's see what the Lyft IPO pricing is at. It's getting pretty crazy. So we'll see what they do. But
and working on your new book. So let us know when you're ready to talk about that in the near future.
Talk about that as we see these digital duopolies like Lyft pop up. They're still floating at about 81.21. So that's where the Lyft stock price is at. So, all right. Well, hey, happy Friday, everyone. And thanks a lot.
Thanks, everyone. See you next Friday. Bye-bye.